Small stones, which are easy to treat, can lead to an irreversible kidney problem if not dealt with in a timely manner. This is because the pressure on the kidney tissue starts to thin it out until it becomes very thin and can no longer function properly. Hello, urinary tract stones are an important topic that we should be well informed about. They are a very common condition that we see quite often. Unfortunately, they are sometimes managed incorrectly. So I wanted to make this video to inform people about what these stones are, their treatment methods, when an endoscopy is needed, and when to opt for medication. Alright, as for urinary tract stones, our urinary system is composed of the kidneys, the ureters, the bladder, and the urethra. Urinary tract stones can be found in any of the locations we've just mentioned. So what causes them? The truth is, there are many reasons for the formation of urinary tract stones, but there is one common factor among all of them, and that is that the concentration of salts in the urine becomes very high to the point where these salts begin to precipitate and form a nidus or a nucleus. Then other salts start to build up on top of it until a stone is formed. How does this happen? It happens when the urine is concentrated. For example, if you're dissolving sugar in a cup of tea, the sugar will keep dissolving up to a certain point. The solution then becomes saturated with sugar and no more sugar will dissolve. It's the exact same idea. When urine is concentrated, the salt level becomes so high that it becomes saturated. That is, it's fully saturated. Then these salts begin to precipitate, and when the salts precipitate, they form the sand we often hear about, the sand in the kidneys. After that, more salts build up on top of it until it forms stones. Not everyone is the same. Some people have a natural tendency to develop stones due to anatomical or physiological reasons. To put it more simply, if you and I ate the same food, drank the same amount of water, and were exposed to the same conditions, you might develop stones while I don't. Why? Because your body has a predisposition to forming them. Alright, so how do we diagnose these stones? This brings us to a very important point, renal colic. The fact is, renal colic is one of the most painful experiences a person can have. So how does renal colic happen? Renal colic occurs for two reasons. First, a stone doesn't cause any pain unless it obstructs the flow of urine. This means if a stone is located in one of the kidney's calyces and isn't moving, it won't cause colic. When it starts to move down from the kidney, or blocks that calyx inside the kidney, or moves into the ureter, that's when it starts to cause colic. How does it cause the colic? First, the ureter contracts to try and push the stone down into the bladder. The second reason is that the kidney fills with urine, the urine that can't drain from the ureter, and this puts pressure on the kidney's capsule, which also causes the colic. What does it feel like? It's a pain in the flank that might radiate downwards. It's accompanied by nausea or a desire to vomit, and may even include actual vomiting. If the stone has moved to the lower part of the ureter, it causes some different symptoms. These include a frequent urge to go to the bathroom. There might be blood in the urine or pain in the penis. All of this pain can also radiate to the loin or the flank. So how do we manage renal colic? With painkillers. The primary treatment for renal colic is painkillers. After we control the pain, we start running tests to assess the situation. To properly treat the stone, we need some information. First, we need to know its exact location. Second, we need to know its size. And third, how much reflux it's causing on the kidney. Based on all this information, we decide how to proceed with treatment. There's another very important piece of information we need. Is there an infection associated with the stone? So what test do we perform? We do a urinalysis and a non-contrast CT scan of the urinary tract. The scan and the analysis provide the information we need to determine how to treat the stone. Now, for bladder stones. Bladder stones are usually the result of urine stasis. What does that mean? It means something is obstructing the flow of urine from the bladder, and the most common cause is an enlarged prostate. As a result, salts precipitate within the bladder and form stones. Usually, the intervention for bladder stones is done endoscopically. We go in and break them up, and at the same time, we remove any obstruction to the urine flow to prevent the stones from recurring. As for ureteral stones, the intervention depends on the stone's location, its size, and as we mentioned, the degree of reflux on the kidney. If the stone is smaller than 6 millimeters and located in the lower ureter, there's a very high chance it will pass with conservative management. So what is conservative management? First, we control the patient's pain with painkillers. We also prescribe medication to dilate the lower ureter, allowing the stone to pass. An antibiotic is given if there's any sign of pus in the urine, and we increase fluid intake to help push the stone out. Now, if the stone is larger than 6 millimeters, located in the upper ureter, or causing severe reflux, then the best approach is endoscopic intervention. We insert an endoscope through the urethra into the ureter and either break the stone with a laser or retrieve it with a basket. It's also highly likely that we'll place a stent after removing the stone. Regarding conservative management, there are a few red flags. If any of these occur during the treatment period, we must intervene immediately. For example, if the patient develops a fever. A fever means that the urine trapped above the stone has become infected. This can severely damage the kidney, so we must intervene at that moment, at the very least by placing a stent to drain the urine until we can decide on the next step. Another reason is if there's severe pain that doesn't respond to painkillers. The goal of conservative management is to avoid an endoscopy, not to make the patient suffer. Nowadays, endoscopic procedures have become so simple that there's no reason to endure the pain. So if you're in severe pain, don't be afraid of the endoscopy and don't just tolerate the pain because you're worried about the procedure. For stones in the upper ureter, there's also another option, which is external shock wave lithotripsy. This is actually a device that performs external fragmentation. It's not a surgery or anything like that. These shock waves break up the stone in the ureter and it then passes on its own. As for kidney stones, we have several methods of intervention. These include shockwave lithotripsy, the flexible endoscope, and a kidney endoscope. Shockwave lithotripsy, as we've mentioned, uses external shock waves. It's not a surgery. It breaks the stone, which then passes with the urine through the ureter and, of course, the urethra. We can use shockwave lithotripsy if the stone is about 1 centimeter in size and located in the renal pelvis or the upper calyces of the kidney. Because quite simply, if the stone is in a lower calyx, the shock waves will break it, but it won't be able to jump up and pass into the ureter, so it will break but remain in its place. So the best solution for stones in the lower calyx is the flexible endoscope, or if the stone is larger, say more than 1 centimeter, 1.5, 2 centimeters, around that size. So the flexible endoscope and the advancements in laser technology have made it very easy for us to treat these kidney stones with a simple endoscope. The patient stays in the hospital for 1 day and is discharged the next after we break up the stone and retrieve it with a basket. Now, if the stone is large, more than 2 centimeters, 3 centimeters, or if it's a branched stone in the kidney, what we call a staghorn stone. It's called that because it branches out from the renal pelvis and into the kidney's calyces. In that case, of course, shock wave lithotripsy is very difficult. It would break the stone, but the stone burden, the high volume of fragments, would be too much to pass through the very narrow ureter. A flexible endoscope would also be difficult. The flexible endoscope uses a laser to create very fine fragments, but breaking a stone this large would take a very long time. Plus, the clearance of those fragments wouldn't be very effective because, as we've said, the ureter is very narrow. So the solution is to perform a kidney endoscopy. A kidney endoscopy is an endoscope that we insert from the side, from here, directly into the kidney. We dilate our tract so we can insert the endoscope, break up the stone, and extract the fragments through the tract we've created. It's not a difficult procedure, but the patient might need to stay in the hospital for more than 1 day because we leave a tube in the kidney after we finish. We need to remove it a day later to ensure there's no bleeding or anything. So please, if you have a kidney stone, don't let it harm your kidney. Try to see a urologist so they can find the best solution for dealing with the stone. Because a small stone that's easy to treat, if we don't deal with it at the right time, can lead to an irreversible problem in the kidney. The pressure on the kidney tissue starts to reduce the tissue itself until it becomes very thin and can no longer perform its function properly. In the end, I hope you benefited from this video. If you did, please like and subscribe to our channel so you can see the rest of our videos. Goodbye.